Welcome. The purpose of this module is to provide an overview of simulation-based learning. The goal is to provide you with the basic knowledge you need to get started in simulation education. Specifically, we will highlight the differences between traditional bedside teaching and simulation-based education, as well as show you the components of a simulation session. These include pre-briefing, the simulation scenario, and debriefing. Throughout the module, there will be questions to assess your understanding of the materials. At the completion of this module, you'll be able to define simulation education, describe the differences between bedside teaching and simulation-based teaching, and discuss the components of a simulation session. There are multiple definitions of simulation. Here is one that works well for healthcare simulation. Simulation is a technique, not a technology, to replace or amplify real experiences with guided experiences, often immersive in nature, that evoke or replicate substantial aspects of the real world in a fully interactive fashion. Simulation is useful for teaching skills. Simulation is particularly useful for teaching high-risk, low-frequency skills. These skills may not be used often, but if they're not executed properly, poor patient outcomes can occur as a result. Flight crews and military personnel have been using simulation-based education extensively for many years. For these professions, the ability to fly a plane in difficult conditions or the ability to manage the stresses of battlefield operations are critical for success. For the same reason, simulation is important to training healthcare professionals. Let's look at some examples of simulation used in healthcare. Screen-based simulation, including virtual reality simulators, live actors, sometimes referred to as standardized or simulated patients, task trainers, such as IV training arms for practicing insertion of intravenous catheters, and high-fidelity mannequins with features such as heart, lung, and bowel sounds. So why is simulation important in healthcare education? First, simulation allows for experiential learning. Simulation engages learners in the process of learning by doing. In this process, learners are immersed in clinical problems that must be solved by applying knowledge gained from lectures or textbooks. Instructors are responsible for guiding the learners to reflect on their actions, analyze mistakes and successes, and discuss how they can apply what they have learned in future situations. The learner's active engagement in hands-on experiences, reflection, analyses, and future application is needed for meaningful learning to occur. Second, simulation offers practice without risk. Simulation allows learners to care for simulated patients and make mistakes without repercussions. In real clinical settings, errors can harm patients, while in simulated settings, learners can practice without risk to simulated patients. Third, simulation prepares learners for independent practice. In simulation, students can assume the role of an independent healthcare provider, while in the clinical setting, they are always a student. And fourth, simulation standardizes exposure. In clinical settings, learners' experiences are greatly variable, while in simulation, all learners have the opportunity to have the same or a similar encounter. Let's look at how simulation-based and traditional clinical learning experiences differ. To think about healthcare education in the real clinical setting, let's consider the following example. The instructor is working with her student in a hospital-based clinical rotation. The student, Mary, is about to give her first injection to a patient and is afraid of making a mistake. The patient is nervous about having an injection by a student and can also sense Mary's anxiety. The instructor's challenge is to balance Mary's learning needs and the patient's safety and comfort.
Hello, Mr. Jones. My name is Professor Ravita, and I'm a nursing instructor. I'm here today with my student, Mary, and we're going to give you your Lovenox injection. Hi.
Hi.
Mr. Jones, can we just confirm your name and date of birth?
My name is Matthew Jones. I was born September 15th, 1970.
Okay. We're going to lift your gown to take a look at your stomach where we'll be giving the injection, okay?
Okay. Excuse me, is this your first time?
Now let's watch a similar scenario in a simulated setting. The instructor is observing Mary from the control room, while Mary independently interacts with the patient.
Good morning, Mr. Jones. My name is Mary Baum, and I'm going to be your nurse today. I have your Lovenox injection here, but before I start, can you confirm your name and date of birth?
Yes, Matthew Jones, September 15th, 1970.
Okay, Mr. Jones. I'm going to give you this medication in your stomach. Do you know what Lovenox is for?
In the simulated setting, the instructor was able to focus on the student's learning needs without intervening to address patient safety and comfort in the moment. The instructor will discuss performance with the student after she completes the interaction. Now, let's look at an example of students experiencing an emergency situation in a real clinical setting. The students initially stand at the bedside while the physician is assessing the patient. Then they are quickly pushed aside by the clinicians responding to the situation and are unable to participate in the care of the patient.
Mr. Smith! Mr. Smith! Can you hear me, Mr. I need help in room 4 now! Mr. Smith, can you hear me?
Get out of the way. You're not involved in the care of the patient. We need you to get out of
Mr.
the
Smith,
way.
can you hear me?
What happened?
Can you check the breath sounds, please? Mr. Smith, can you hear me?
Mr. Smith,
Are the breath sounds equal?
Kristen, I need you to call the rapid response team now.
Calling now. Move in the corner. Get in the corner.
Mr. Smith, can you hear me?
I need rapid response in room 4 now.
In an emergency situation in a clinical setting, students often become observers, not participants. And usually, they do not have an opportunity to fully understand or be debriefed on what transpired. Now, let's watch the students participating in an urgent scenario in a simulated setting. Notice the students are able to provide all the patient care and make decisions based on their assessment.
His oxygen saturation is 89%. Joanne, could you listen to his lung sounds?
I'm going to put some oxygen on.
Sure, I'll do that right now.
Mr. Smith? Mr. Smith, I'm going to put some oxygen on you.
I'm hearing a lot of wheezing. Maybe we should give him an albuterol nebulizer.
Oh, I think that's a good idea. Why don't you get the albuterol ready, and I'm going to hook up some IV fluids, and then we can reassess.
Sounds good. I'll get the albuterol ready right now.
The instructor prepared the students for this scenario before it began, but during the scenario, the instructor observed from the control room, allowing the students to manage the patient independently. The instructor will provide the students feedback on their performance and help them make sense of the events after they complete the scenario. So, to summarize, in the clinical setting, the learners remain in a student role. While in simulation, the learners can practice as independent clinicians. Additionally, in the clinical setting, learning opportunities are often incidental. In the first scenario, the student was able to administer an injection. However, the other students in the clinical group may not have had the same opportunity. By contrast, in simulation, learning opportunities are planned, and exposure can be standardized for all the learners. In the second scenario, the students were not able to participate in the emergency situation in the clinical setting. But in simulation, they were performing all patient care during the emergency. In some clinical settings, students are not allowed to administer blood products, IV push medications, or provide central line care. However, in simulation, learners actively participate at the upper limits of their ability. To review the previous content, please answer the following questions. Now, let's move on to discuss the 3 components of a simulation-based learning experience. These components are pre-briefing, sometimes known as pre-conference, the simulation scenario, and debriefing. First, let's look at pre-briefing. One purpose of pre-briefing is to activate the learner's prior knowledge. This is essential to help students connect material learned in lectures or from textbooks to clinical practice. The second purpose of pre-briefing is to introduce the patient and the scenario and to orient the students to the simulation environment. Faculty generally should not tell the students how the scenario will progress or what the outcome will be, so the students can respond and participate as the scenario unfolds. However, the instructor should review capabilities and limitations of the simulation space and equipment. For example, whether the simulation mannequin has pulses or respiratory and bowel sounds. The instructor should also review the location of the telephone or other ways to call for help, and the location of any other essential equipment. The final purpose of pre-briefing is to establish a safe learning environment and that mistakes are opportunities for learning, as well as addressing confidentiality and respect. The pre-briefing may be as short as 5 minutes, but can be longer depending on the content. Now, let's look at a brief clip of a sample pre-briefing.
Before I give you a brief orientation to the clinical area, I'd like to talk about taking care of patients here in the simulation center. You might feel awkward or surprised in this new environment, but just do the best you can and respect and support each other. We believe that everyone here is intelligent, cares about doing his or her best, and wants to improve. I would like you to reflect deeply on your practice during this experience. We'll maintain confidentiality of what happens here, and remember, mistakes are opportunities to learn. Given the simulator's limitations, we'll do our best to create a rich and engaging environment. And for your part, the simulation will be a much more valuable learning experience if you participate as if this were a real patient in a real hospital unit. Does that sound okay? Great. So this is the medical surgical unit where Mrs. Hernandez was admitted for care. I'd like to orient you to the room and to your patient. You can feel for pulse.
The instructor is now orienting the students to the simulation environment. The students can meet and feel the simulated patient, and the instructor is explaining how to use equipment, where to get supplies,
Where you can call the
and how to call for help. After the pre-conference, the simulation scenario will take place. The goal of a simulation scenario is for learners to engage in an environment where they can apply previously learned knowledge. The scenario should be designed to meet the specific learning objectives. Learners should perform at or beyond the upper limits of their expertise. In general, individual students or teams should assess the situation, interview and examine the patient, communicate with other clinicians, and develop a plan of action. Generally, the scenario will be about 15 to 20 minutes in duration. Let's look at a brief clip of a sample simulation experience.
Hello, Mrs. Hernandez. I'm Chad McCarthy. This is Mary Baum. We're going to be your nurses today. Before we get started, would you please verify your name and date of birth for us?
Yes, my name is Maria Hernandez, and my date of birth is May 6, 1960.
Thank you. How are you?
Not so good. I came to the ER because I felt like I couldn't breathe.
You felt shortness of breath.
Very. It was so hot outside and my air is broken. I also haven't taken my medications for a few days. It was just too hot to get to the pharmacy. I thought it would be okay.
Okay. Why don't we review what medications you regularly take?
I take the water pill, it's called Lasix, and a few other medications. But I want to tell you that my chest feels very heavy. It's still hard to breathe.
Okay. We're going to go ahead and call your doctor right now, okay?
Okay.
Let's review the principles of pre-conference and the simulation scenario by answering some questions. Now let's talk about the third component of simulation, debriefing. Debriefing is the conversation that occurs immediately after the simulation scenario. It is an important component of simulation where much of the learning occurs. The goal of debriefing is to help the learners reflect on their actions and allow them to learn via input and feedback from the instructor and classmates. Faculty and learners discuss performance gaps, as well as areas of accomplishment. Learners are guided to analyze their thought processes and decision-making in order to improve or sustain their performance. Mistakes are opportunities for learning in an environment where a patient can't be harmed. In terms of the duration of debriefing, a common rule of thumb is that a debriefing is 2 to 3 times as long as the simulation scenario. For example, a 20-minute scenario might have a 40 to 60-minute debriefing. Let's take a look at a sample debriefing.
How are you feeling?
That was stressful.
And confusing. I wasn't sure I did all the right
Yes,
things.
I can see how that could be confusing. We'll explore some of the things that led to that confusion in a few minutes. First, can someone summarize the events of the scenario?
We walked into the room and Mrs. Hernandez told us she was experiencing shortness of breath. So we began our assessment. I wanted to listen for the patient's lung sounds. I also wanted to get some further history, like if she was experiencing any chest pain. Because we had sort of arrived on the conclusion together that because she was experiencing shortness of breath, that would lead us to figure out if she had CHF or not.
That's good, a good line of thinking, Chad. I'm sure you all have lots of questions, and we're going to hopefully be able to get to everything that you're wondering right now. And all those thoughts you're having and feelings are normal, and that's what this is for, and we'll hopefully be able to get to all of your questions. Today, I'd like to talk about prioritizing care for patients with congestive heart failure exacerbation, how to assess these patients, and also communicating with the interprofessional team. Let's start with prioritizing care for a patient with CHF exacerbation. Mary, I noticed that you administered 20 milligrams of Lasix IV push before implementing the other interventions. I think that was the appropriate prioritization of care for this patient, and I wonder what were you thinking at the time?
I remember that diuretics can help patients excrete excess fluid volume, decreasing the workload of the heart. So I thought it would be important to give the diuretic first, before implementing some of the other interventions, which I didn't think were as important. I was concerned that the patient hadn't taken her medications in a few days, and I was wondering if I did the right thing. Maybe I could have called someone else or asked for a doctor's opinion.
Okay, good. So we'll address all of those concerns. And thank you for sharing them, Mary. So what did you learn that you'll take with you to clinical practice?
I learned that
As we saw here, the instructor starts by letting the students express their immediate reactions, which helps deactivate the students' emotions and ready them to engage in the debriefing. Summarizing the main points of the case will help to ensure that everyone is on the same page about what happened. Notice the instructor stated her point of view, so the students weren't guessing what she thought about their performance. She also asked the students to explain their thought processes rather than just critiquing their actions. The debriefing ends with a summary phase, in which students are guided to synthesize what they learned into takeaways for clinical practice. Let's review some questions about debriefing. To review, simulation is a technique to replace or amplify real experiences with guided experiences. Simulation is experiential learning that helps learners make the connection between book knowledge and its application. Using simulation, students can increase their independence without risk of harming a patient. There are 3 components to a simulation experience: pre-briefing, the simulation scenario, and debriefing. In debriefing, students are guided to reflect upon the events of the experience. Faculty can identify performance gaps and areas of accomplishment. In simulation-based learning, both errors and accomplishments are opportunities for discussion and learning. In this module, we have provided an overview of simulation-based education. There are many opportunities for learning more about simulation. For example, there are courses at a variety of academic and healthcare institutions, including those offered at the New York Simulation Center for the Health Sciences in New York City. While your institution's simulation program may vary, we hope this particular module provided you with the basic knowledge that you'll need to get started in simulation. For more information, please visit our website, nysimcenter.org.